Hi, good evening, everyone. You're watching Dr. KK's MEDtalks non-stop show. Today, I welcome you all on this show. On this MEDtalk live conversation, today we'll be talking about a very special topic, that is obesity. I'll be the host for today. I'm Dr. Atul Dhingra, and this is a special edition. Uh, we all are seeing patients with obesity in our clinics. Many of us are struggling with this problem, and all of us have one problem, that whenever we do some sort of exercise or some sort of dietary restrictions, our weight comes back to its original point. So there is some sort of set point in our weight, and this is what our topic is going to be today. Today, we'll be talking about the science behind this set point theory. So yeah, like I was saying, many of us wonder why I'm not able to reduce my weight. That despite all of these lifestyle changes, all of those moments of missing my favorite dessert, going to the gym for those countless hours of training, still while I'm able to lose some amount of weight, but then again because of something goes about, and my weight comes back to what it was originally. So today we explore on this burning topic, why lifestyle changes alone are not the key to reduce weight, and why obesity is a chronic disease, and why we face these challenges. Uh, Before we begin, uh, let's hear some of the key updates on obesity. There are new So yeah, there are new findings that have suggested that BMI may not be the good judge of diagnosing obesity, especially in the elderly patients. We see patients where they have normal weight, but their body fat percentage is very high. And if you're using bioimpedance, you'll be astonished to see that even at a BMI of 23, the body fat percentage goes above 30% in many of our patients. And this is especially true in elderly, those who have not been exercised for quite some time now, and their muscle mass has been reduced. There is another problem. There is a major gap between the research and what reaches to the patient. So I've been talking to some of my patients, and I asked them, how do you know about the drugs related to obesity? And to my astonishment, 95% of these users told me that they got this information from social media, and that was not a very accurate information. They were more worried about the problems that are not commonly seen. The social media has highlighted those problems much as compared to what we actually see in our clinics. So there is a gap between what the research is going on in obesity and what our patient knows, and probably we need to fill those gaps. And there is also some newer mortality data which has shown that number of patients with heart disease are increasing, and most of these heart disease patients can now be attributed to obesity. And there is also evidence that weight loss, especially with weight loss surgery, not only reduces weight but also significantly improves blood pressure, one of the markers for CV disease, thus helping individuals in managing their CV risk as well. And according to a recent Lancet finding, excessive consumption of ultra processed food, especially among Indian adolescents, has been fueling higher rates of obesity early, and especially early onset obesity and cholesterol abnormalities. And now we have been routinely seeing these patients uh, uh, in a clinic as well. So let's go to on today's topic, which is set point theory. Why lifestyle advice alone fails. So this is what we are going to discuss today. And for this discussion, we have a very eminent speaker with us. And so let me introduce you to our guest for the day, Dr. Vitull K Gupta. He's a distinguished physician, health and human rights activist from the Malwa Belt, and he's a respected leader in medical community. He currently serves as a chairman of the API Malwa branch, and he works as a consultant at Kishori Ram Hospital and Diabetes Care Center in Bathinda, Punjab. He has immense clinical experience, and he's strongly committed to public health. And I've been reading his articles in various newspapers as well, articles on things that really matter. I believe he has taken health, he looks health holistically. It is not just talking to a patient sitting across, but he writes on the issues that are really important for community health. And I believe that is a way to make big changes. Just by reading those articles, you can understand the depth of his knowledge and his character. So, welcome, Dr. Vitul. It's a pleasure to be with you on this evening.
Thank you, Dr. Atul, for kind words. So I think we should go in with the topic.
Yeah.
Yeah,
So, set point theory. What exactly, sir, do you feel, and how does it explain why people regain their weight even after dieting and exercise? I myself have tried this, and believe me, it's difficult. Your weight comes back whenever you lose it.
definitely true. So again, I will thank IJCP and MEDtalks for initiating this rather important discussion because I feel, as you have told, in resource constrained country like India, where health services are not adequate, I feel personally that one thing is of immense importance, that is education and awareness, both for the physicians as well as for the patients, to optimize the healthcare services what we have at our hand. So, in that direction, I think IJCP and MedTalks are going in for a great service to spread education. So I must thank again IJCP for giving me this platform. And education and awareness for public health is my passion. So I am pursuing it. And with the help of my senior mentor, friend, Dr. G.S. Wander, I am initiated into education, awareness, as well as research. So, coming on to the point, what exactly is the set point theory? So this is real important question, as you have already discussed, that you will find some patients who come to us that I cannot lose weight or I have regained weight. My willpower is less, I am putting less efforts. But if they know what set point theory means, then they will be, not having frustration that why I'm doing this. So set point theory means that body has inbuilt weight range for a person, which is determined by several factors, including the brain, especially the hypothalamus, that constantly monitor and try to keep the body weight within the range. Supposing a person's mind or the genetics has set point of 80 to 90 kg, so if he starts losing weight, the body tries to build up to keep the weight in that range. So a rigorous diet is initiated and there is a sudden weight loss. The brain thinks that something is wrong and tries to initiate the processes to keep the body weight in the range. So that is known as set point. That if the weight decreases, the body tries to build up, and if the weight increases again, there is a stabilization of weight. So it is not lack of willpower alone, but it is the biology of the body which is trying to keep your body within the set point. So one must understand that set point is inbuilt genetic, and so many other things. And if the weight goes beyond or less, the body tries to keep within the range. So don't get frustrated. Your set point, we will be discussing in future how to reset the set point, but you must know what is the set point theory. So I think your question is answered, Dr.
Yeah,
Atul?
absolutely, sir. Absolutely, sir. An important point is that it works both ways. So even like if you are having a viral fever and you have lost those kilos during that viral illness, probably you will gain those kilos
Yes,
back once you recover. So this is what
yes.
happens, and it works both ways. So if you are trying to lose just by this, you need to understand what Dr. Vitul is saying, that don't get frustrated. It is part of your biology that you are again regaining weight, and we'll be excited to listen to from him how to reset that set point. Sir, how what is obesity? How is it really controlled? How much biology is there? And can just by willpower, can I change my set point?
So definitely you can, but to certain extent. So human biology plays a very strong role through hormones, genetics. The gut health is coming up in a very big way. The gut flora is determining almost each and every system of the body, including sleep and stress. So these are the signals which constantly influence our appetite and metabolism. So it is a multifactorial thing, including willpower, which can be a strong part, but in front of biology it may be a minor part in that. So willpower is important component, but power alone cannot fight the hormones or the body functions which are going on, like leptins, insulin, ghrelin. There are so many other stress hormones which which the willpower cannot overcome. However, willpower does help to start lifestyle modifications like better sleep, activity, mindful eating, which over time teaches our brain to accept the lower weight. So, that is how, through willpower and lifestyle modification, which is a very slow process, it is not over months, it is over years, that we can reset. But one must understand that willpower cannot overpower the biology on long term basis. And in majority of the obese people, medical and life support to lose weight and then to maintain weight is real important. But definitely willpower has a significant role in starting the lifestyle modifications, but ultimately it is the set point and what we have inherited in
That
our
is
biological system, what we have enumerated, has a significant role.
some of very important things said by Dr. Vitul. So, uh, I believe if we go back to Gita, uh, Bhagwan Shri Krishna did say, "Karam kiye chal, phal ki ichha mat kar." So we have to start doing the karma. That is our willpower. You have to start doing that, and you have to, like you said, you have to be very you have to start sleeping on time, you have to take care of your stress, you have to eat healthy. All of these are things of willpower that are actually required to make that first change. Then probably will be requiring some amount of help from medications from your health coach. So everything of those things will be required, but one important thing is, yes, willpower is important and biology is also important, but you start with willpower and then you take care of the biology. That is a very good message, because we have commonly now we have been seeing with the availability of all of these medications that many of our patients don't want to start with the lifestyle modifications. But like you said, it is the lifestyle
Yes.
modification that is the first thing that has to be done. So one of my friends, so we were both doing DM, and he used to eat more than me, but his weight was always lesser than me. So what was the difference? I was eating less. We were running exactly equally, because we both were doing DM, and in AIMS we had to run for quite a lot, because yeah, we had a lot of calls. Physical activity was, I believe it was very similar in both of us. But still, he was thinner as compared to me. So, what was the difference between me and him?
Excellent question, because this rises with everyone कि डॉक्टर साहब वो इतनी रोटी खाता है, वो पतला है, मैं आधी रोटी खाता हूँ, मैं मोटा हूँ. So that goes for everything, and you have referred to Gita. I think the traditional thoughts is कि किस्मत की बात है. So this is to explain otherwise, but the answer remains in the different metabolic structure for person. Like the fingerprints are not equal in all the people, similarly the metabolic pathways or metabolic rate for everyone works differently. They may burn different amount of calories per day for different amount of work, or you can say that their efficiency is different. You might be spending or burning 300 calories for certain work, the other person may be burning 100 calories or 500 calories. If you are burning more calories, you will be thin, you will be, you know, digesting or using those calories, and the other person might be conserving the calories. So it can be slower burner or it can be faster. If a faster burner, it will be thin. If slower, it will be fat. Another important fact is behavior of the gut bacteria. So I have already said gut bacteria is coming up in implication of quite a lot of disease pathophysiologies. So they may extract more or less calories from the same food. And most importantly, the response of various hormones. So there are three main hormones and five minor hormones, which the behavior of those hormones may be different in a different individual. So even if the two people, eat the same quantity of food, same work as you have told, but they may have slower metabolism, they may have higher metabolism, which is again regulated not by the willpower but by the biology. So that is how we can substantiate that human biology frames the prime role in determining the obesity or the body fatigue in the body processes what we encounter generally. So that is how you explain to a person कि आप आधी रोटी खाते हो, आपकी बॉडी बहुत एफिशिएंट है, वो आधी रोटी से भी बचा लेता है. पर अगर कोई 10 रोटी खाता है, ही इज स्पेंड थ्रिफ्ट, वो ज्यादा खर्च करता है और इसलिए वो पतला है. तो इट ऑल डिपेंड्स अपॉन द ह्यूमन बायोलॉजी, विच इंक्लूड्स हार्मोन, गट बैक्टीरिया, योर लाइफस्टाइल, योर स्ट्रेस, पर again regulated by the hormones in the last.
So we again come to the same question. So that means genetics is an important component to this, and how genetics is associated with this set point regulation, and how does my body decide what my set point should be?
So again, time and again, human biology, genetics, and hormone. I think the listeners will be repeatedly hearing these factors,
Yes.
and willpower as a fourth or fifth factor. So several factors like genetic plays an important part. They gather information from all over the body, that it fat cells, stomach, intestine, muscles, even the stress hormones, and send the comprehensive signals to the brain where it is integrated. They are analyzed, and the brain decides what is the safe weight for that body. So again, it is set. You will find the obese people, parents have generally obese children, and they have to work doubly hard to lose weight. And so, if the weight drops at this level, the brain automatically tries to pull your weight up. So that is the set point. That one point is this, other point is this. Your body keeps the weight between these 2 points. If it goes down, it tries to swing back. If it goes up, it tries to swing back. So body tries to maintain a constant weight by increasing hunger, lowering the metabolic rate, making you crave for high calorie food, reducing energy levels. So the brain genuinely believes that it is protecting the body, though it may be frustrating for a person who is trying to lose weight. So that is why such programs initiated by IJCP and MEDtalks will help them understand that it is no need for frustration, but try to implement those measures which are going to, in real sense, set your weight point so that you are benefited and you lose weight.
Yeah, absolutely right, sir. We get what you're trying to say. That obesity is a genetic, indeed, has a
Yes,
strong genetic
disease.
component to it. And like you were saying, we see patients who are obese, their children are also obese. And I believe how physically active uh, these patients are as kids also is one of the factors that leads to obesity in the adulthood. So I believe childhood obesity is one of the reasons uh,
Yes,
that has led to this obesity epidemic in our country. Uh, we used to hear from our grandmothers that uh, मोटा बच्चा खाते पीते घर का होता है, and probably this is the this is the
definitely.
mindset that probably we need to change, that healthy bacha is more important than a mota bacha. Yeah. Sir, we have talked about genetics and all, and there are a lot of diets that people have been doing. People have been doing keto diet, they have been doing very low carbohydrate diet, protein only diet, paleo diet. But I have seen that after a few months, these diets fail. uh, the patient starts regaining their lost weight, and probably they gain more than what they had lost on these diets. Your take on this, sir? Why
Sir,
does it?
again, interesting question. I must compliment you for asking the questions which has real importance. As you have said, कि दादी बोलती थी कि बच्चा अच्छा मोटा अच्छा रहता है. तो when we were students, obesity was sign of prosperity.
Yeah.
But now it has been declared as a disease. So there is a great shift in understanding obesity and role of genetics also. Similarly, you have asked that strict diet, the weight starts reducing, and after sometimes it stabilizes or the person regains weight. So again, all the four factors, five factors, they really matter. That set point is there, genetics play part, the environmental factors like stress, sleep also plays part. So strictly low calorie diet puts our body in starvation mode. So when we eat less, the brain senses that the person is in starvation mode, and in turn it helps loses weight because we are taking less calories. And after some time, the body sets the protective mode into action. So there is a protective response to the strict low calorie diet by slowing the metabolic rate, because the body tries to conserve the energy by slowing the metabolic rate, and there is faster muscle breakdown to reduce, because the calories are being burnt by the muscles. If muscle mass is less, the body will burn less calories, and there is hormonal reset. So when we start low calorie diet, the body is in starvation mode, and body senses that something dangerous is going to happen, and it resets all the things. So while initially losing weight quickly, the body tries to reach the set point and conserve weight. So that is why the crash diets almost always lead to weight regain after some time. After initial loss, either it stabilizes, you will not have the same loss with the same calorie restriction, or in majority of the persons, the body starts to regain weight. So that is how from starvation mode to protection mode for conserving energy and resetting the parameters what we have lost, the body tries to regain. So that is how After some time, on crash diets also, the people stabilizes, there is not much loss after some time, or they start regaining weight.
Yeah, absolutely, sir. You explained it very beautifully. Why crash diets don't work, and it is not a very good way to go about the weight. Like you were rightly saying, it is important that these messages are spread across to our community that weight is a chronic disease. You need to look at like that only.
The disease.
It's a slow process. Fast measures will not give you a durable result. So you talked about hormones in regain of weight as well as in weight physiology. So what do the hormones like leptin, insulin, and ghrelin do, and how do they influence our weight metabolism?
So again, interesting question. These are the three major hormones, and you have two, three minor hormones like stress hormones, etc., which influence the weight. So these hormones work like a messaging system between your fat cells, gut, and the brain. So there is a coordinated signaling system. Like leptin produced by the fat cell tell the brain that I am full. When we eat, the signal, the leptin increases, and it tells the brain that now I am full. We don't eat, we stop eating. And when you lose weight, the leptin drops and hunger increases. So that means when we lose weight, there is a signal to the brain through leptin that body is losing weight. We need to increase hunger to maintain our weight. So that is how leptin works. Second is insulin, which regulates. Normally, insulin is related to diabetes and it regulates blood sugar, but high level of insulin, especially in insulin resistance, because most of the obese people have insulin resistance, so they signal about the stored fat. If the fat starts decreasing, insulin increases, and it is an anabolic hormone. It helps in store fat. Ghrelin is a hunger hormone. It rises during dieting and prompt you eat more. So that is how the hormones act in presence of losing weight, and together these hormones defend your set point. So they all are helping the body, and when you diet or when you start reducing weight due to any reason, they all come into action in a coordinated effect to maintain the body weight in a sense that they are protecting the body. So that is how these hormones they interact through signaling system, and integration in the brain occurs, and the secretion is controlled by how the body is responding to loss or regaining weight.
You explained it in a very simple language, sir. It was absolutely delight to listen, and you made it absolutely crystal clear that what hormones lead to what and why do we regain weight, what happens to the hormonal system, why once we are starving, what happens to ghrelin, it increases, you start eating more amount of food. So it was really great to listen to you on this. You talked about stress also in weight regain. In today's world, we are all living a stressful life. We are running here and there. Your take on stress as a reason for obesity in today's world. What does this stressful life do to us, and why sleep is important? This is especially for our adolescent listeners or young listeners, because just before this talk show, I had a patient. The mother came to me that she's sleeping at 12 or 1 at night. She's constantly on her phone, and then she gets up late, and she was struggling with obesity. I believe you also might be listening to these stories in your OPD as well.
Definitely. So stress is a very, very important factor. In fact, it is very easy to say in modern world कि tension kam lagao, fikr kam karo. So this happens. So even if you are stress free, you are driving a car, you are stressful that somebody is going to hit even if you are following the traffic rules. So that is how the stress is being implicated in almost all the non-communicable diseases, as well as sleep. Sleep hygiene is also coming up in a very big way for obesity or non-communicable diseases. And long-term stress is real important. What you are telling in adolescents, it is the online media, or you can say use of the mobile phones or computers, which are adding fuel to the fire. So it is very, very important both ways in increasing obesity and non-communicable diseases, as well as mental health issues also. So stress produces a stress hormone named as cortisol, and which if increases during stress, and it boosts appetite, especially sugars and high calorie foods. The adolescents you are talking about, they take, as you have mentioned in the beginning, that ultra processed foods are very, very important ingredients for ill health in adolescents. And during this stressful period, the cortisol, they stimulate the intake of such foods. And when they are readily available, the adolescents or anyone for that matter, irrespective of age, indulges in taking such foods. And lack of sleep reduces leptin and increases ghrelin, what we have discussed in the previous question. Thus, these two hormones are also resetting for increase in weight, increase in hunger, stress hormone is increasing, sleep deprivation is adding to the hormonal imbalance, and you feel more hungry as you go through your routine or sleep deprivation. When your body doesn't need extra calories and you are feeding extra calories, what is going to happen? The obesity is going to increase. And over a long time, when the weight increases, the body increases the set point from the lower set point to the higher set point over a period of time. So we can reduce also, we can increase also through such methods. So reducing stress by various methods and sleep hygiene, we can maintain our stress, the set point at a lower level. And if we regain weight, or the body has a more set point for that uh, activity, then it will be very difficult to reduce weight. So that is how the stress with sleep and hormonal imbalance is adding to the increase in prevalence of obesity.
Yeah, so absolutely right, sir. You rightly pointed that it is the stress hormones like cortisol, which is increased, and ghrelin is also increased, and leptin is reduced, which is associated with the stress, and it is one of the reasons of weight problems. Just for the sake of our viewers, sir, any tips for our young friends, how they can manage the stress, and some tips on phone hygiene as well, on screen exposure, just a few tips
So
for other.
it is again a great informative question, because such tips are known to everyone. Only thing is, we have to stress again and again, generate awareness, and generate the motivating force that everyone follows those tips. So it is very difficult sometimes कि chips का पैकेट पड़ा है आप chips नहीं खाओ, कोल्ड ड्रिंक पड़ी है आप कोल्ड ड्रिंक नहीं पियो. But if you know the dangers and how these things are going to help you, it is motivating and inspiring, where do you will resist such things. As the set point we have discussed in a few minutes before, that the set point can be increased also, like over a period of time with unhealthy activities the set point is increased, and similarly the set point can be decreased, but it has to be a very gradual exercise. This set point doesn't change overnight, but it can be downstrung with sustained habits, and that is traditional things: early to bed, early to rise, makes a person healthy, wealthy, and wise. So that is putting the sleep hygiene into proper perspective. Regular exercise with mixed exercise, you can say aerobic exercises, strengthening exercises, which increases your muscle mass. As we all know, muscles are going to burn more calories than fat, so it helps in the burning of calories. Constant sleep cycle, again, sleep hygiene is very important. Stress, we have already discussed how the stress is going to, de-stressing ourselves is going to help us in resetting weight. High protein diet and high fiber meals, they increases satiety and negate the effect of hormonal imbalance, which increases the hunger. And treating medical issues like the polycystic ovarian disease or hypothyroidism. So whatever disease you have, you need to control that with the help of your doctor. And in many cases, obesity medication or surgery like bariatric surgery may help in the beginning, and in long term that helps us in setting our set point. That body feels that 90 kg is our set point today, but with these measures, but mind you, they have to be very, very gradual. If we want to get instant results, it will be counterproductive. We will have more harm than benefit. So, key is long term, as our teachers used to tell us now also, that obesity disease now is considered as a disease. It is not a destination but a long journey.
Mhm. Absolutely.
So even if we start to reduce obesity, we should know it's a lifetime process, and that is how gradually with these methods, our body set point will be reduced, and we will be able to maintain weight.
Absolutely right, sir. And again, you summed it very beautifully. So what I understand is, if we are doing it drastically, our brain gets डर जाती है कि that something
Yes,
has gone wrong.
gone
We need
wrong.
to shake it up again, and it
Bilkul.
again tries to bring back to the same weight with the force, and sometimes it overshoots it. And there's
Yes,
the problem with all the crash things. And if you are doing it slowly, then what we are doing is like in that movie, all is well. We are saying all is well, all is well.
yes,
And
yes,
by that process, slowly, the brain doesn't feel that something
yes.
difficult is going on, and probably things go about it. So,
So we are
absolutely.
poisoning the brain slowly. The slow poison doesn't raise alarm, and you achieve your method only by going slowly.
Absolutely right, sir. So you have already answered my question, that can set point be reset again? And yes, if you are going it slow by a slow process, you are not making your brain stimulate those processes by going about it slowly. Probably it can be reset, and it can be reset for a long term also. So my next question, probably I'll be taking an advice is, what changes will you advise me? Because I'm not a very diet conscious person. I like my paranthas in the morning. There are patients who come to me who say that I want to have parantha, but I can do this exercise more, or I can change everything around it more. So what lifestyle changes do you advise to such? Do you give advice to such patients?
So whenever I go for lifestyle changes, I always remember Sanjay Kalra. So his lecture is so informative. So
Yeah.
since I am listening to him for last 4 5 years, it has changed my practice, that how I communicate with the patient.
Yeah.
So he generally tells that it should be positive first, negative afterwards. So if you say कि ये चीजें नहीं खानी है, तो पेशेंट सोचेगा मैंने और खाना क्या है.
खाना क्या है?
तो यू
Absolutely.
शुड स्टार्ट विद कि यू कैन ईट एवरीथिंग. आप हरी सब्जी खा सकते हो, ये खा सकते हो, ये खा सकते हो. आप आलू कचालू अरबी और हाई कैलोरी फूड मत खाइए. So
What?
you have so many things to eat. You can leave these 4 5 things. So those you should not eat. Or you can eat these fruits and you avoid these fruits. So go with the positives first. कि आप अगर कितना रोटी चौपड़ते हो, अगर आप 1 चम्मच में, तो आप आधा चम्मच कीजिए, स्लो प्रोसेस, एंड आफ्टर 6 months you go to this and you go to this and you will relish those things. So we should talk about positive things first, that patient may not be again fear, like brain fears कि मेरे से कुछ होने वाला है, so it resets the point, it lowers the metabolism, decrease the calorie this thing breakdown. So that is how it regains weight. So lifestyle modifications are again integral part and first step to management of obesity, or for that purpose any non-communicable disease. And start with your food habits. Eat balanced meals, enough proteins and fibers, reduce bad fats, reduce calories from fats, and increase complex fibers, complex carbohydrates. Because I think the meal is the major important factor. If we consider the previous concept also, calorie is a calorie. So exercise is supplementing our efforts which we are initiating by dietary constraints. Like I generally give an example that one biscuit had 40 calories. Take any biscuit, whether it is salt, it is Mary biscuit or any biscuit. You read the packet, it is 100 gram is 483 calories. So it amounts to about 40 calories per biscuit. And if you exercise, you walk and you spend 2 calories per minute by walking. So if it is very easy not to take one biscuit, but it will be difficult for a person to
Walk.
use that biscuit by 20 minutes of walk.
Walk. Yeah.
So that is why diet is real important, and exercise gives you additional benefit of cardiovascular strengthening, of your health wise, as well as your effort supplementing for weight reduction. And in today's world, the restriction of ultra processed food, वो भी डॉक्टर कालराना ने बताया था कि जो भी पैकेट में आता है आप रसोई में नहीं बनाते हो, कंसिडर इट एज अल्ट्रा
That's a
प्रोसेस्ड
process.
फूड or any
Yeah.
packed food. I like to quote Dr. Kalra whenever lifestyle modifications are there, because he is an
Yes.
excellent speaker, excellent motivator for lifestyle modifications. And prioritize your sleep hygiene. 7 to 8 hours of sleep is real important, along with stress management. Stress management, it is better said and difficult to implement, but the now scientific evidence suggests that yoga, meditation, and pursuing your hobbies, like in
Yes.
exercise also. If you like dancing, go for dancing exercise. If you like cycling, go for that. So whatever you relish, you enjoy, adopt that. So stress management is important. And last and most important is your teamwork. So teamwork is your consultant, your family, and yourself. So family sport and peer sport is important, because sometimes the friend used to, mock the person. कि
Yeah.
तू मोटा था यार, पतला हो गया, दोबारा मोटा हो गया. So that is real demotivating force.
Yeah.
So these all sports with healthy environment creates, and it helps your body to lower the stress, the set point, and again over a period of time. No quick fix, no one fit all size. Everyone has got different hormones, as we have already discussed, different hormone metabolisms. So different type of diets, different type of exercises will be working differently in different people. So find out what you like, what you can adopt, which is sustained over a period of time. Adopt that part. Don't look for other person के वो ये कर रहा है, मैंने ये करना है. So that is how you can achieve your lifestyle modifications over a period of time and have a healthy weight.
Absolutely right, sir. It has to be individualized. जो आपको पसंद है वो आप करो,
वो ही
जो
कीजिए.
आपके लिए अच्छा है वो आप ही के लिए अच्छा है, और उसी में आप लगातार कर पाओगे.
बिल्कुल.
Absolutely right, sir. Your words of wisdom are truly a treat to hear. We have talked about lifestyle modification, sir, but sometimes we understand, and we talked about it also, that sometimes we need to go beyond these. Are there medications that can help, or are medications useful in setting this resetting this set point?
Yeah, definitely. So previously we did not have effective medicines. So we relied on lifestyle modifications, whatever we could get, or surgery, bariatric surgery were the option. But now in recent times we have very good medicines which are going to help us. So we start with the willpower and lifestyle modification, see the results. If they are optimum results, we continue with those over a period of time, setting the targets, very lower targets initially. But if we are not achieving those targets, then medicines like diabetes. You start with lifestyle modification, diet restriction, your blood sugar is controlled, you continue. If it is not, we start adding medicine. So consider obesity as a disease, start with lifestyle modification. If it is not being treated, now I am not using the reduction of weight, but treatment of obesity. If it is not being treated, we are not getting optimum results like in diabetes, then it is optimum to start with medication. And for medication, education is real important. You should know about the side effects. You should consult your doctor, and he is a better person to guide you about medical therapy. And modern anti-medicine medicine are designed to regulate your hunger hormones. So again, they are controlling or manipulating the hormones to achieve weight, whereas lifestyle modifications, they are is not modulating the hormonal balance. So improve state, the brain accepts. जैसे कहते हैं ना कि हमारे से नहीं माना तो पुलिस बुला ली, तो पुलिस ने समझौता करवा दिया. So this is how to teach brain. We need medicines so that they reset the set point, the healthy set point which the body needs. So with medicines, the persons who used to regain weight after losing weight will have a stabilizing weight. So the medicines as well as lifestyle, they are not replacement to each other, but they are complementary to each other. Lifestyle modification we have to continue, and with or without medication. But medications are coming up as a very efficient way to treat the disease of obesity. Again, I am using the disease of obesity. Like diabetes, we need treatment, we need pharmacotherapy. Now, the pharmacotherapy is available for obesity, and you should not hesitate in adopting the pharmacotherapy if the lifestyle modifications fail.
Uh, yeah, absolutely right, sir. We need to talk about this to our patients, and like in the beginning also we showed one of the research that did say that there is a gap between what the research is going on and what the patients actually know. And there was another
Definitely.
important thing that you said, that you need to consult your doctor whether you are a right candidate for this or not, because we are seeing the other part of the story as well, that we are getting calls from patients that I am going to be getting married in next 3 months,
Yes.
and I want to reduce those 5 kgs to fit in that dress. So we need to look at it in a pertinent way, and we need to be very clear on indications, and we need to talk about it in a detailed manner with our patient. It has to be discussed, and like you said, then once the patient understands, once we understand what the patient expects, that he or she does not have expectations that cannot be met. So it has to be clear on all the fronts. Then the medication works better. You are very correct in saying this. So we have talked about medications, but we have been doing surgery for quite long time. Your point on bariatric surgery in setting the set point, is it really necessary now with all the medications? Do you still see surgery as one of the measures that has to be taken?
So again, as you have already told, that obesity is a disease. like in diabetes or hypertension, we work out the case. We go for detailed history, physical examination, investigation, seeing the target organ damage, how the things are working. Similarly, for obesity, we must do that. Whether this patient needs lifestyle modification, medication, or bariatric surgery. Bariatric surgery, we have experience of long time now. So it has, one of the most powerful tool in resetting the set point. The medicines are here. We have been using those medicine for treating diabetes. But for obesity indication, it is more or so recent as compared to bariatric surgery. So it changes the gut hormones, reduces hunger, improves insulin sensitivity, and help patient feel fuller. And it is going to reduce again. The hormonal balance is maintained, and the bariatric surgery is going to modulate that to reduce the set point over a period of time. And most importantly, the brain begins to defend much lower weight. So the lower weight is considered to be the set point, and with bariatric surgery, now the patient or the person doesn't regain weight what it has lost, what was usually happening when we were going in for lifestyle modifications. A person reduces weight and lifestyle modifications, with same lifestyle modification, it regains weight. But this doesn't happen with bariatric surgery. So, bariatric surgery, the patient maintains the weight loss, and for non-communicable diseases also, you will find there is reduction in anti-diabetic medicine, anti-hypertensive medicine, along with other parameters. They improve with bariatric surgery. So bariatric surgery, and now there is a debate also that why to spend so much money on drugs which are having side effects, why not go for bariatric surgery? So like in CABG and PTCA, so whether you go for heart surgery or you go for PTCA for left main, so it will be a continuous debate. But intelligent doctor, they are going to risk stratify lifestyle modification, irrespective, we are going to implement. Whether that person needs medication or person needs bariatric surgery will depend upon so many parameters which a consultant will decide according to the patient's profile. But bariatric surgery, definitely long period of time, excellent procedure. And what to say about bariatric surgery more?
You have been very clear on that part, so that it is a graded thing. Some patients will require just lifestyle modification. There will be some who will be doing good with the drugs, and probably there will be a niche who will be requiring surgery as
Yes,
well. And that is where the role of us physicians comes in.
yes.
That is where a good physician helps his or her patients. It was You were absolutely crystal clear on that. So thank you. Uh, Many of our patients have lost weight, and now they have lost that motivation. How do you advise your patients to stay motivated to prevent that weight regain?
So basically, again, very important and very tough question. So motivation comes only with awareness. So once we know that there is a snake in our room, we take all the precautions before entering the room and try to capture the snake or call for external help. Similarly, if a person has lost weight, again regained weight, first thing he should realize that obesity is a disease, not sign of prosperity, or not only with eating things. So it is the brain or biology or multifactorial factors which set up our obesity set point or weight set point. So first thing and first foremost is to make him realize that what obesity is, how the lifestyle methods are going to work over a period of time for resetting your set point. And if your resetting or lifestyle modification fails, you have to treat obesity with pharmacological or surgical methods. So we need to motivate, make the patient aware, educate the patient. Only then he will be, motivated to control weight, or adopt methods accordingly. And for staying motivated, again, support of the family, support of the doctor is real important. If the doctor is giving them a positive, like Dr. Kalra used to give their patient a positive attitude, I think you will be, you know you will get more patients motivated, and they lose weight and maintain weight. So that is how we are able to motivate the patients, by making them aware about their disease and possible treatments, not only willpower.
You're absolutely right on this. That education is I believe the key word here. That if your patient is educated, that yes, these are the things that you are going to see in next years, and this is why you need to keep on working on whatever you have been doing to reduce your weight, because weight may come back if you stop following the lifestyle modifications. And we have been talking about Dr. Kalra. So I remember one of his stories. So I was in his OPD once, and so I had the pleasure to be with him. So a patient walked in, and this was a young patient with her son, and the consultation was regarding obesity. And sir, an absolutely simple line he told her that कि मुंडे ਦੇ ਵਿਆਹ ਤੇ ਆਪਾਂ ਨੱਚਾਂਗੇ ਨੱਚਣ ਵਾਸਤੇ ਆਪਣੀ ਬੋਡੀ ਫਿਟ ਰਹਿਣੀ ਚਾਹੀਦੀ ਹੈ so that is
Definitely.
that is how he motivates by simple words. So he has given her a long term goal now. You
Yes.
see, it is a long term goal that when his son is going to get married, you have to be fit enough to dance
Yes.
on his marriage. And that's one thing that delights a mother, that she'll be dancing on her son's wedding. And she left with a smile. So these are the things actually work. And you are right that you learn from the magician every time you listen to him. So, just you have been talking about the support of the family. Any practical steps which families can do to support a member who is trying to reduce weight? How can a family be supportive in this whole thing?
So basically, as we have discussed before, that it is family, your doctor, or your friends, and the patient. There has to be a teamwork. If there is a weak link anywhere, whether it is your friend or family or yourself, the goal will not be achieved. And family plays a very crucial role. First and foremost is avoid criticism or body shaming, which is very, very important. कि ये मोटा है, इन्हें क्या करना है, तो बेवकूफ है, इसको तो अकल नहीं है, मोटे बंदे के दिमाग गिट्टे में होता है, पैरों में होता है, like that. So that is real demotivating things. And second thing, again, mother is an important factor, that in kitchen sometimes the family has to sacrifice the things for the want that that food is not available for a obese person. So whole family should adopt a healthy food habits, and if the food is not available, like high calorie food or ultra processed food is not available at home, and you will find 90% of the time the obese person, the food is not available, he is not going to take. And healthy food habits again is a family option. नहीं तो कहते हैं कि इसको तो सूखा पराठा दे दो, मेरे को दो मक्खन के रख देना. So that creates a conflict. So in the mind also, stress also, again stress hormones are going to increase. And again, if a spouse or a mother, father, or someone in the family is going for a walk, they can take the person along. If he is fatigued, he can rest for 5 minutes, again continue. So that is a culture that family adopt for walk or exercise or outdoor activities. And sleep hygiene, again, if one person is seeing TV for till 1 a.m. in the morning, you cannot ask some other person to sleep at night. So you
Yeah.
have to adopt the same parameters for stress, for sleep management, and take the, if medical visits are needed, we can have a regular medical visits. Not that कि आज मेरे को काम है 2 दिन मेडिसिन ना ले बाद में चलेंगे. So that is how the family is going to be very important and crucial factor in motivating the person also. Even if he has lost half a kg, we can say that half a kg is in the beginning is very good. We should maintain half a kg per month. So that is how the motivation is there, and that applies to not only the family, the friends, whosoever matter in supporting the person in reducing weight and in turn have a healthy life.
Yeah. So family is one of the important component, and
Yes,
if all the family members try to follow that lifestyle, probably it becomes easier for the person in question to
yes.
reduce the weight. Uh, so thank you, sir. It was pleasure to be with you here. Uh, I myself learned a lot from you, and uh, how this past 1 hour went. I was just mesmerized with your words, and it was really pleasure to listen to you. Just before we go, sir, any last words for our viewers?
So, Dr. Atul, it was reciprocal. So it is always a learning process. You learn from people like Dr. Kalra, Dr. Sunil Gupta, Bansi Sabu, Dr. Wander was my mentor since first day of my college. So I am lucky to have good friends, good motivating personalities, inspiring personalities. And one I add your name also. So we will be interacting in future a lot many times. And most importantly, Dr. KK Agarwal. I knew him for very beginning for about 20 years. He was a great personality, always with a stethoscope. So whenever he used to come for the dinner also, there was a stethoscope. And after him, IJCP is maintaining a good educational, or rather, excellent educational or awareness campaign. I met his son at this conference, and I really appreciate their efforts in making people aware, educate them in a bid to control the diseases and generate awareness. So thank you IJCP, thank you Dr. Atul for kind words and the opportunity provided to interact.
Thank you, sir, for joining with us today. So that will be all for today. Keep watching Dr. KK Med Talks. Thank you and good night.
Thank you.